Tobacco use remains the leading cause of preventable death in the United States. More than 500,000 people die every year from smoking-related disease. And for every one person who dies from tobacco-related disease, 30 are living with a tobacco-related illness. So the burden is tremendous, and the impact on health is really enormous. The Southeastern Pennsylvania Tobacco Control Project Coalition is made up of a diverse group of community-based organizations, healthcare systems, public health organizations, all working together toward a common goal. And that goal is to improve the health and well-being of people who live, work, and socialize in Southeastern PA. And also to reduce the burden of tobacco, which seeks to eliminate health disparities. The coalition really works at two levels. It works at the individual level and the community-based level. Individual level, we connect individuals with cessation resources, also known as tobacco dependence treatment. Those resources are free to anyone who is interested in quitting smoking or using any other tobacco product. We also provide nicotine replacement therapy free of charge. And our tobacco dependence treatment providers are incredible. They're experts in the field, they understand the nature of addiction, and they really work with clients beautifully. The policy work that we do really is aimed at protecting non-smokers from secondhand smoke. Secondhand smoke is very dangerous and accounts for about 41,000 deaths every year in non-smokers and about 400 infants every year. And that's why we really we're doing the work that we do. And that's why policy work is so important, because it really helps to protect people who are not using tobacco products from the dangers of secondhand smoke. We've had 2 new multi-unit housing complexes go totally smoke-free in our region this year. And then we've provided technical assistance to another 17 housing developments. And overarchingly, we've protected the health of about 11,500 residents in multi-unit housing buildings, which we're really, really proud of.
We decided to make our community smoke-free really because we had a number of residents who asked for that amenity. My experience working with the Southeastern Pennsylvania Tobacco Control Project has been really positive. They've been great at providing resources for us. They provide ongoing monthly support groups for all of us who are converting our buildings over so that we can make sure that we're using each other's best practices along the way. And they also provided wonderful documentation that helped us to set up the legal framework for our leases for our residents.
Well, our project is very data-driven. So when a disparity is identified through statewide data, we jump into action to try to partner with an organization who can reach that disparately impacted community. For example, when the Pennsylvania LGBTQ Health Needs Assessment identified years ago that the burden of tobacco is greater in that community, we partnered with Bradbury Sullivan LGBT Community Center to work on smoke-free policies and Pride festivals. And we're really proud because all 7 Pride festivals in our region are now smoke-free, which is amazing. And also to connect members of the LGBTQ community with resources that they need to quit smoking when they're ready.
By meeting the demand for these smoke-free spaces, we are doing a few different things. We're setting a better example for the next generation. We're denormalizing tobacco usage. We're protecting our community members from secondhand smoke. And we are generally creating a much more supportive environment for LGBTQ+ smokers to take pride in trying to quit, and we kind of use the slogan, living proudly, living longer.
Getting Further Faster has allowed us to really dedicate time and resources to evaluating our efforts to date. And anytime you can take a deep dive and look at what's worked and what hasn't worked and what you've done so far, it's really helped us to formulate, and it'll help us to continue to grow our efforts and improve our efforts, especially as we look forward toward improved youth empowerment, improved youth prevention, tobacco-free recovery. I think the lessons learned from being a part of this project will help us to improve for future efforts. At the end of the day, we're talking about people. How can we help people? And the goal of the coalition is to improve the health and well-being of people who live, work, and socialize in Southeastern Pennsylvania.